Hey guys, it's Dr. John Mark here from Simply Physio. I wanted to demonstrate some of my favorite mobility stretches, exercises to help improve ankle dorsiflexion. So I'll show you what ankle dorsiflexion is, but as anybody with tight calves or inability to bring their knee forward over their toes. So first, how do you know if you have tight ankles, tight calves? I'll show you two quick tests that you can self-assess yourself. So if you get your foot against the wall with your knees straight, you should be able to lift your foot off that wall, keeping the heel on 10 to 20 degrees. Now 10 degrees if you're semi-active, 20 degrees if you would consider yourself more active, maybe participate in some recreational sports. So if you're struggling to get that foot just barely off the wall, chances are you have either tight muscles there in the back of the ankle, or the calf, or the soleus, or a tight ankle joint. One way to see if it's more ankle versus muscle is to do a kneeling test here against the wall. So what you want to do is you measure a fist width, put it down here between the wall and your big toe. And you should be able to keep your heel flat on the ground and bring it in and touch the wall. Now, if you're getting close to the wall and your heel starts coming up, then it's likely more either a soleus issue, which could be the muscle, or just a tight ankle joint. So I'll show you a few exercises for both of those if you're finding yourself having restrictions. The first one, just to loosen up the muscles there in the back of the leg, is just using a foam roller. And really just rolling out that calf back and forth. And the calf tends to have a lot of big old trigger points. So you can turn there to the side to get the outer portion of the gastroc. Wherever you feel some tension or not, you can just focus in on that area. You can also get a little bit more of the inside by rolling towards the inside. If you have real big knots and you're having trouble getting them out yourself and still restricted, I'd recommend finding a therapist that does some trigger point dry needling. Is my go-to tool for releasing muscle knots and tension quickly. So that's a good way just to prep the area, prep the tissue. So for stretching, a few options. You have your tried and true. Just prop your foot up on a wall, lean forward so you feel that stretch in the calf, usually holding about 20-30 seconds, 2 or 3 times. You can also, if you have a step, you can just drop the heel off. That's again to get the gastroc. If you want to get more the soleus, you're finding restrictions more with your knee bent. If you bend the knee and then drop down, you're going to be able to stretch more the soleus. Now for ankle, more mobility, more tightness there in the ankle, our same test that we did, you can just turn into a treatment where you're just trying to lunge forward, trying to keep the heel down. If you're feeling really ambitious or you need some extra help, what you can do is get yourself a mobility band. You can get these off, this one's off Amazon, maybe like 15 bucks. Rogue Fitness has kind of the best quality there. But you can strap it there on the front of your ankle to get a little bit of extra pull, and then do your same lunging forward with the tension of the band helping to glide the ankle backwards. Just like that. And that will help more with a tight ankle joint. So that's really great. Those are all some of my go-to exercises for improving ankle dorsiflexion, tight calf, tight gastroc, or limited mobility down the joint. Thanks.